Pas pour arrêter, pas mon fleur là, yo mange à quitter la vie. Apprécier ça, yo ka fait qu'on yo a parmi nous aujourd'hui. Là c'est mauvais valet, puis non, nous ka crucifier mon évi. Faut nous connaître pour meilleur, c'est pour nous tout ça bénéfice. For all the wonders you done for us all, spreading the culture all over the world. For all the good things that you done for God, that's what makes. We thanking you. We thanking you, brother. Ajalo moun bisou pasav ki chale yo point wivi ici.
Good morning. Bonjour. Tout le monde à tout quoi la Dominique et aux Antilles, c'est un grand plaisir pour nous là avec Zom ici. Nous allons bienvenue ici pour Station Creole Heartbeat, ça c'est une émission et nous allons partager toute information qui est passée, la vie, monde, culture, tout ça. Et aujourd'hui là nous avons une spéciale émission pour vous. Nous allons remercier tous ces monde là qui déjà branché à ce radio DBS International et puis tous ces monde là qui déjà à ce médias social, Facebook, YouTube, tout ça. We want to say good morning to you wherever you are, wherever you choose to be at this point in time, possibly at the office or at home or just relaxing. Today we have a very important topic we're going to delve into, and that's a very sensitive one, but mental health. We know the taboo. We know the stigmatization of the whole subject. It is one that we sort of afraid to discuss on various levels. Well, Creole Heartbeat decided we're going to delve into this particular area and educate our nation, educate our people about this particular subject. And to assist us doing so is Dr. Kala from our Solutions Institute, our Solutions Specialist. And she's a psychiatrist, she's a psychologist, and she's a psychotherapist. And she's going to give us some more information about how to cope, how to deal, and possibly give us tips on how to identify where to go to if you are feeling that you may have some issues. And you may be walking around and things are happening to you, things are going on with you that you may not be aware of. And let's see how we can have a real educational hour as we examine ourselves and examine our peers, examine our family members, examine society, and examine Dominica's mental health. Good morning to you, Dr. Kala.
Good morning, Wadix. Thank you so much for having me on the show. I feel very honored.
And it's a pleasure to have you.
Thank you.
I must say the smile, as usual, radiant. How are you? How have you been?
I've been very good, thank you. Just
Okay,
busy, very busy.
I can imagine.
Trying to keep the people of Dominica sane.
Okay. This is a tremendous... How difficult is this, trying to keep the people of Dominica sane?
It's a bit of a challenge.
I can imagine.
Yeah.
I can imagine with, I guess, several areas of stress, depression, anxiety, that sort of thing. But tell us about your professional background.
So I'm actually a doctor as well as, and I've done further studies as a psychiatrist, and I also have a PhD in psychology. So I guess I'm a bit of everything. Counselor, psychologist, psychotherapist, psychiatrist. So I work in the mental health field because that is my passion, my area of interest. Yeah.
Okay. Tell us, where have you practiced before?
So I have worked in a lot of countries around the world. So I'm basically internationally recognized. So I've worked as an example, I worked in the States, I worked in Canada, the UK, Australia, New Zealand. So I have an international practice, our solutions specialist, and that is an online 24/7 telehealth and telemedicine practice.
Wow.
So that we target clients all over the globe. At the moment, it's from English-speaking countries, but we are hoping to expand later once we get more foreign-speaking professionals.
Tell us a little more about that online practice that you have, and tell us a little more, give us some more information about it.
Okay, so my practice is called our Solution Specialist. Our website is actually being updated at the moment, but it will be ready in about a week or two. So I will send you the link.
Yep.
So we have 4 main areas of practice with our Solution Specialist. So the first area is we do telemedicine. So people can ring up 24/7 and consult with a specialist, so either a GP or a psychiatrist or a specialist. We have like neurosurgeons as well, but that one is not available 24/7 because obviously with the specialist we need to have them prepare for the appointment. The second part is we do telepsychology services, so counseling, psychotherapy. We do assessments, all the psychology assessments. Yep. And the third area is we do a lot of life coaching and motivational coaching. So that means people who are running small businesses can contact us and ask us questions, about how do we start a business? I'm not motivated today. What do I do? Or even on a personal level, people might wake up and, sometimes they might feel depressed and they just cannot get out of bed to go to work, right? So they might just ring up this, our online service and speak to a professional and say, look, I'm really struggling today. What can you do? So we offer strategies. And the fourth area is the corporate assistance. So we work with a lot of organizations and businesses to provide them with group training programs, whether it's team building, conflict resolution, setting up business strategies. So we try and tailor the programs to suit the organization.
What is mental health?
Wow. That is a big question, isn't it, nowadays? Mental health, to me, my definition of mental health is actually the well-being and I guess general health of somebody's mental state. And that means your medical mind, your psychological, emotional mind, as well as your spiritual mind. Because the human body is a holistic body. We cannot look at one without looking at the whole, the whole. Yeah.
Okay, and in terms of mental health issues, there's a tab that once you are mentally ill, that you are mad, or you're crazy, and that's how it is known in Dominica, which has been, a myth, because that's not true. What are some of the types of mental health issues that one can actually experience?
Well, the most common mental health issues I get presented with when people approach me is depression, anxiety, and there's also, I find in Dominica there's a lot of trauma, and a lot of that trauma has stemmed from Hurricane Maria. The inability to speak about what people saw, the devastation of their homes, their country, and it's a trauma that has been deep-seated in people. Like, they don't know who to talk to. They can't really talk about it. It's kind of like you just have to pick up and move on with your life, sort of thing. So they bottle it up.
People are still suffering from Hurricane Maria after all this years?
Yeah, definitely. A lot of the time they don't realize, they don't realize it. But that's the thing with trauma. Trauma is like this hidden demon inside. It kind of comes up when you least expect, and sometimes things can trigger it as well. Like, for example, they might have had someone break into their house and steal a whole bunch of valuable stuff, and that could have triggered a memory of everything they lost in Maria. But they probably can't link the two together, unless they speak to a professional that helps them kind of link where that trauma stemmed from. Yeah. And
issues such as possibly losing everything in seconds, in let's say minutes.
Yeah.
And there is a level of impact that the body goes through.
Yes.
And one may not notice it, but it's there. As a psychologist, as a psychiatrist, you absorb a lot of those feelings.
Yes.
At some point in time, the body breaks down. Tell us about what happens during the occurrence of whatever event it may be.
Yep.
and then until the body breaks down, what actually happened and what can be done.
Okay. So that's actually what we call grief and loss. You know, when you experience grief and loss, it's also a part of a form of mental illness. And grief and loss doesn't necessarily mean the death of someone close to you or, you know, a friend. Grief and loss could also mean like, you know, I crashed my car, or someone crashed my car and I've lost my car now, you know. So it could be a physical or material item. And the process that happens is when you go through loss, you know, it also takes a little bit of the identity away from the person, because whatever we have, we associate a kind of an identity to us, you know, like this is my phone, this is, you know, my glasses or something like that. So there's that loss is kind of like an onion. There's lots of layers to it. So we kind of need to peel through that onion. And I always say to my clients, it's a little bit like a volcano. You gotta imagine yourself like a volcano. Every time you go through a challenge in life, and if we struggle to deal with it, it's like the volcano's getting closer to exploding.
I know.
Yeah. And then finally one day you'll get to a point where it erupts.
Yeah.
And we try to avoid that.
I know. But why do people with these issues, why are they scared of actually coming to the fore and trying to seek assistance?
There's a lot of reasons why people fear asking for help. You know, one of the main reasons I find is, well, I guess cultural. You know, cultural reasons are a big thing, especially here in Dominica. They don't want to be labeled as crazy. And there's also the issue about confidentiality. A lot of people have said to me they don't know how confidential their issues are going to be with that professional because Dominica is so small. And the third thing I find, the third factor, is also the fear of being judged. You know, if you share your issue with someone, and whether they're a professional or not, there's always that fear that, oh, this person's going to think I'm crazy or I've got issues. But the bottom line is we've all got issues. You know, everybody has their issues. It's just about trying to get help to sort out your issues from the right person. Yeah.
So, I mean, having said that, process one,
Yes.
somebody must be maybe experiencing some level of depression, some level of anxiety.
Yeah.
And what you recommend would be the first process for them to actually go through to seek assistance to try to remedy this particular ill or this particular situation they are going through.
Okay, so the first and most important thing is for them to recognize that they have a problem. Okay, and there's nothing wrong with personally recognizing it. Like, you don't have to share it with anybody, but just recognize that, yes, you know, I have a problem. Number 2 is acknowledging that problem and saying, okay, you know what, I'm going to do something about this. Okay, so who can I call? Who can I contact? You know, and then the third process, I guess, is finding the right person to talk to. You know,
when you say the right person, how does one decide or differentiate between, you know, several doctors as the right person, especially in a small community like Dominica where everyone knows everyone?
I know, that's a tough one. Yeah, that's a tough one. And that is one of the challenges, the major challenges a lot of my clients here in Dominica face. You know, they say to me, because, you know, my doctor is like the distant cousin of someone else, you know, and I'm afraid that my personal circumstances are going to be leaked out. So they fear that confidentiality is going to be lost. And so I find that is the biggest issue why people don't open up. Yeah. In terms of trying to find a professional, I mean, look, me personally, I go through word of mouth. I generally tend to ask people what their experiences are, because you won't know, you know, you really don't know unless someone has been to a professional and they can vouch for that person. Or, yeah.
Actually, as we continue, PTSD,
post-traumatic stress disorder.
Yes.
Yeah.
What it is, tell us a little more, elaborate on it for us.
Okay. So post-traumatic stress disorder is part of trauma, the broader category of trauma disorder. So what trauma is when you experience a very life-threatening event and your body goes into shock, right? And I mean, it really shocks your mind and your physical body. and to the point where it's kind of like imprinted in your mind. It's imprinted in your subconscious, and you might go into shock for a few days, few weeks, but then after that, some people actually go back to normal, and it doesn't resurface until, could be days, weeks, months, years later, when it comes back. And the most common example, I guess I can give you, is war veterans who have experienced PTSD. Yeah, they've seen war, and when they're in that environment, it's horrible. When they come back home, it's like they come back home to peace and relative quiet, and it doesn't affect them until later on. They might get flashbacks, nightmares. They can't sleep. They get insomnia. So these are all some of the symptoms of PTSD that come up, and I try and teach people how to differentiate that between depression, because it's kind of a very fine line, with diagnosing mental illnesses, because they all intersect. It's like this, they kind of intersect each other. You can't say I've got depression but I don't have anxiety. Most likely if you have depression, you have anxiety, and you probably have PTSD as well. So it's kind of this mixture, like a mixed salad.
But then, how would you assess the difference to be able to reach to a conclusion or a series of remedial areas to deal with that particular client in terms of depression, anxiety, PTSD? You may have to differentiate.
Yes. So what I do when I treat a client, usually you can't have a one treatment plan fits all. Okay, so every client is different. So some might experience PTSD symptoms more so than the depression symptoms. So what I do is I always do an initial assessment. Okay, an initial assessment. I meet with a client, and then I have a very good idea on what strategy to take. So I will then talk to the client about it and say, okay, this is what we need to do. And usually when we do that, it's like I say, the onion, it's like peeling layers of the onion. So we have to go one layer at a time, and you have to be very slow too, about the healing. Yes, because a lot of the time too, people are impatient. I mean, we're all guilty of that, right? I'm guilty of that. We want something, we want it quick. I have a headache, I want to take some paracetamol for it. But however, with mental illness, you have to, it takes years to get to that stage. So it might take a bit of time to actually heal from that. So I always say to people, the most important thing is patience, because we have to deal with one thing at a time. If I rush through it, their brain is going to shut down. They're going to feel too overwhelmed, and they'll say, no, this is too hard, I'm not going to do it. So we don't want that. We want people to go slow at their own pace. So it's manageable.
General stress. Living in developing countries like ours, the stress is in abundance in terms of economic stress, family stress, work stress, that sort of thing.
Lots of stresses.
Lots of stress.
Yes.
How would you, what advice would you have for people going through those levels of stress, and how would you recommend for them to manage it?
Okay, so what I usually recommend people to do is to break it down. Okay, like usually stress is more manageable when we break it down. And sometimes people think it's silly, but when they do it, they actually say, oh, it works. So I say to people, get a piece of paper, write down everything that is stressing you. Okay, and prioritize them. Which ones are most important? Like, okay, if I have to pay my mortgage, are they going to take my house away? So that's number one, right? So then deal with number one first. You know what I mean? And once you've crossed that off the list, then move on.
Let's do a practical. We're going to do a practical.
Oh, we're going to do a role play, are we?
We're going to do a practical exercise.
Sure.
Good morning. How are you?
Very good, thank you. How are you?
I'm fine. I heard so much about you. I've been really stressed.
Okay, I'm sorry. Really
stressed. So I decided to come to you. I understood you are the expert. You have assisted several people. I'm not sure how you can assist me.
Sure. Well, thank you for putting your trust in me, Wadix. And I would love to be able to help you in any way I can. So can you please tell me about what factors are stressing you out? What are the causes?
Lots of things are stressing me out. Work.
Okay.
I'm overworked, one. Two, I have some issues family-wise that I want to sort out.
Yeah.
and it has been kind of on my mind. I also have problems sleeping,
Okay.
and I also have lots of problems in maneuvering decisions that I have to make because some of them are pretty heavy. Financial stress, you need things, you need to survive in
Yes.
communities like this. And sometimes it can be difficult when the bills come and the revenue, the disposable, is not there to deal with the bills.
Yeah.
And it can be real hectic. Sometimes I feel, like I possibly need to go somewhere or run from it.
You want to
I'm not
run
sure.
away.
Yeah, run
Yeah.
away from it.
Yes.
How can you assist me?
Well, okay, out of all those factors that are causing you stress, okay, we need to work through them one by one. Okay, so which one would you say is a priority right now out of all of those?
Economic, financial.
Okay, so when you say financial, can you break that down for me?
Well,
please?
for one, when the bills are around on the month end, which you have to meet,
Okay,
adequate disposable is not available mainly because you don't get paid on time,
okay,
and the employer kind of pays later, and the demand on getting the bills paid at a particular date
of course.
comes on you and overwhelms me. So then
Of
that is the
course.
first one.
Okay, well, the bill companies aren't going to wait for you, are they?
Exactly.
Okay, so the first thing I would probably recommend is perhaps, we could sit down and work through your budget. Okay, if you're comfortable with that, we can sit down. It will take a bit of time, so we'll sit down with a piece of paper, we'll work through your budget, and we'll see what we can shift around in your budget, and maybe that might help a little bit. And we can talk a bit more as well about whether, are you the sole provider for the family? Do you have assistance? Are you able to get assistance? Things like that. So we're looking at the practical aspects as well, okay? Because the practical aspects often affect you mentally too. It's everyday life, and I'm a very practical practitioner. You have to look at practical aspects. Okay.
My lady is narcissistic. She always thinks she's right.
Right.
Is this a mental issue?
Are we out of the role play? What is that?
We are still in the role play. It's still in the role play.
Because
It's
this is
because
a
it's a
separate-
stress. Because this is a stress. It's stressing me. We're still in the role play.
Okay.
How do I deal with this?
Okay. So
She's always right. No matter what, she's just always right.
okay. So I would probably, is that a priority for you, or
It is a priority.
So what would you
Because
say is more
when
of a,
when you do whatever you do out your home, and that's the rest of your day, and you should be spending around 8 hours minimum,
Yes.
within your own space.
Yeah.
And if it is not as harmonious as you expected, it can
No,
be
of course
it,
not.
it can be a real stress.
Okay. Okay, so I think in order to deal with your stress, like I said, we need to deal with one issue at a time. Okay, so if you think it's financial and economic, then we need to work on that first. Because working with your partner and the narcissistic behavior, that involves couples counseling. Okay, it's more of a relationship issue, and that is very complex. Okay, so that would take time to actually work on that. And when you work on the relationship issue, it tends to get very messy as well, okay, because there's two sides there. So I would suggest you have to think about which one you want to work on first, okay? And then we can focus on it. Because if I work on everything at the same time, it's going to overwhelm you, and then you'll probably go, nah, I can't do this, I'll give up. So we can definitely
So
deal
very
with
important. We're going back now. We reversing roles now.
Reversing
So
roles.
very important from what we just experienced is to prioritize whichever stress that you're going through.
Yes,
And
definitely.
you work on the stress one after the other, the various stress issues,
Yes,
one after the other,
yes.
which is what you would recommend.
Definitely.
So you cannot, so then if you try to work on all at the same time, what can happen? Or what are some of the...
Well, they'll get overwhelmed.
Overwhelmed,
Okay,
yeah.
overwhelmed. Depends on the issues. Like, for example, if you have financial issues and you have behavioral issues with your children, as
Yeah.
an example, we have to work with that because you can't let children go, unmonitored and let bad behavior get away with. You know what I mean?
Yeah.
So those kinds of things we can kind of work together. But when it comes to digging through relationship issues, that's kind of like opening a can of worms.
But narcissism is a real problem
Yes.
in Dominica.
Yeah. Well,
what
I
it
think
is,
worldwide.
well, yeah, worldwide, but I know I can because we're speaking on the local front first.
Yes.
What it is, what are your suggestions on how you can deal with it, or person that you are working with or dealing with who is of that particular behavior that you
Okay.
have to deal with every day? And let's deal with this two, and then we'll go further.
Okay. So, how to deal with narcissistic behavior? Okay. So,
Is it a
firstly,
mental disorder?
yes, yes. So it's a narcissism is actually a narcissistic personality disorder. It is a disorder. Okay. So before I answer that question, let me do a definition of what narcissism is. Okay. So narcissism refers to the negative characteristics of a person. And these characteristics are they're very selfish, self-centered, they're manipulative, they're coercive. Okay, so in other words, to put it bluntly, they're very good con artists. Okay, because their focus, narcissism is a focus on oneself. So they only care about themselves. It's like the world revolves around me. I don't care about anybody else. All right. So narcissistic people tend to also be bullies, and you will find children with these sorts of personalities at school as well. So how to deal with them? Well, what I say to people how to deal with narcissistic people is to ignore them, because narcissistic people love attention. They love drawing attention to themselves, and a lot of the time they manipulate, they coerce, they do all sorts of things because they want control. They want to be able to control the other person. Okay, so
When you say
don't-
control, you're talking about control the person's mind in particular.
Yes, yes, definitely, definitely. And that comes from the underlying factor that narcissistic people are very insecure. But you would never think so, because if you look at them, they present themselves as very confident, like they know what they're doing. But deep inside, they're actually very insecure individuals. So in order for them to feel validated and worthwhile in society, in their life, in their family, whatever it is, they have to exert that control. Okay, so they're basically bullies. So the best way to deal with bullies is to ignore them, don't give them attention. And of course, like if they cross the line and do things they're not supposed to do, I mean, you make a report, you make a police
But
report.
is one of the tendencies of that particular disorder aggression
Yes, definitely.
and abuse?
Yeah, definitely. So narcissistic behavior is seen a lot in criminals, and it's seen a lot in perpetrators of domestic violence. Okay, yeah, those are the most common scenes where you find narcissistic behavior. Yeah.
And you recommend you just ignore. But if you are in a situation where you deal one-on-one with that person on a daily basis, and they are your boss, they make demands on you, they have deadlines on you,
That's a tough one
and
if they're your boss.
they
eh?
use that behavior or that disorder to manipulate you. What do you can't just ignore. What do you do there?
No, I mean, you in that scenario, if that person is your employer, I think you need to sit down and try and talk to them first. My personal and professional advice is always to be tactful and diplomatic first. You do the right thing. You sit down, try and have a conflict resolution meeting with them. And if that doesn't work, then I guess you need to make a decision. Do you want to stay there and put up with that behavior? Because clearly that person is not going to change, So then you might have to be faced with making decisions then. But, I don't know about a lot of places in Dominica don't have that assistance, but sometimes certain workplaces, you actually have employment assistance programs where you can go to a third party and seek help to mediate the situation. But I find that is not really available here in Dominica, so that makes it very tough. So
you yourself do that sort of
yes, definitely. I do
for
mediation.
instance, let's
as
say
well.
workplaces maybe facing some challenges, going through some difficulties, and let's suppose that I'm just going to think of one example. Let's say a fellow employee passed, and he was close with everyone else, and they may not be sure how to deal with a situation like that.
Yes.
You offer those kind of services where you can come and talk to the workplace.
Definitely. Yeah,
and
definitely.
that sort of thing.
Yes, so that falls under the corporate services of the company. So what I do is I will then go out and do a group grief and loss group support, therapy support. So I've done that before where, an employee has actually passed very suddenly, and all the colleagues have been very traumatized
Yeah.
and going through loss and grief. So the boss man actually contacted me to say, can you please come in and help, the employees. So I did a group, kind of a group counseling session, but it was a huge group of 12 employees, and everyone gets to share their opinion, and how they feel about that. So that's
How
very
important it is, to assess oneself. Okay, for instance, we do normal checkups, medical checkups, and that
Yes.
sort of thing, but you hardly find anyone doing mental
Yes,
assessments
mental
or
health,
mental
yes.
checkups. But within your practice, how important that sort of practice is, and how often would you recommend one to do some psychological assessment? Because this
Very
is
important.
a touchy one. This is a very
Yes,
touchy
it
one.
is.
Because no one believes that they have anything wrong with them
Mm-hmm.
to actually go to somebody and ask them to assess them.
Yeah, exactly.
So tell us, how important is this?
Very important. Yeah. So for me, that would be the top of my priority list. And what I can do is I can share what I do, I guess, as an individual every day. I mean, as a therapist, we do need to evaluate ourselves as well. So what I say to my clients is that we are no different from you. We have issues too. So what I do is every morning I wake up and I do a quick evaluation of myself. Some mornings, we all have good mornings and we have bad mornings, right? So some mornings I wake up and I don't feel so good. And so I'll do a just quick mental evaluation and say, okay, what's wrong? Why don't I feel good? What am I stressed about today? All right? Blah, 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 blah. I have a list. And then I look through that list, or, I might write it down, or I might just have a mental list if it's 2 or 3 things. And then I say, okay, can I resolve this myself? If it's just small issues, minor issues, yes, I can resolve it myself. And we all have challenges every day. But if it turns out to be issues that are pretty severe and deep-seated, like if, say, for example, I have a bad memory of my past that's bugging me, then I know, okay, that's a red flag, right? That's a red flag. So if I'm still feeling the same way tomorrow about this, I need to go and seek help. Yeah. So I think everybody has that capacity to do that. It's just whether we want to or not. And we need to take time. It's like every morning we have a shower, you wash yourself clean, you make sure you are clean, right, to start the day. So mental evaluation is very important because that's like you're kind of cleaning your mind. You're doing that reflection for a couple of minutes in the morning to say, okay, what's the state of my mind? Is my mind clean, or do I need to kind of have a shower, mental shower? Yeah. So that is the quickest method, I guess, of evaluation. And then from there, if there are deeper issues, then I would say they probably will need to go into detail with a professional.
What happens when the mind is traumatized? What really happens? Give us an idea of when the mind is traumatized, what happens?
A lot of things could happen. So with trauma, it depends on how bad that trauma is, how significant it is. If it's a long-standing, deep-seated trauma, it could affect someone really adversely, really badly, meaning the person could suddenly one day wake up and be in a vegetative state. I've seen that, where people have let trauma slipped by and they've not dealt with it for years, and suddenly one day it just hits them like a ton of bricks. They get up and they start crying and they say to me, I just couldn't function today. I couldn't pick myself up to go to work. I don't know what's wrong with me. And then they start to panic because they think there's something medically wrong with them. But it's actually almost like a mental paralysis. That's what happens when your brain cannot deal with stuff. It shuts down.
It freezes.
Yes, it freezes, it shuts down. And when you shut down, physically you shut down because your brain controls everything, right?
I know.
Yeah. So that's usually what happens in a worst case scenario. In a not so bad scenario, people might experience symptoms of depression. So they might feel really low and, they'll think it's depression. A lot of the time people think it's depression. They present with symptoms of depression, anxiety as well. They'll say, look, today I just don't know why I couldn't sit still. I was so tense, I had to keep walking around, or I'm losing my temper all the time, whether it's with their spouse or with their children. So these are all red flags that come up.
We are here. This is Creole Heartbeat. We are here with Dr. Carla. She's a psychologist, psychiatrist, and also psychotherapist. And we're just sort of going through some of the challenges that one can face with mental health. We know it's around us. We know quite a bit of us deal with it on a daily basis. We know our peers or family members deal with it. But the difficult part of it is to actually talk about it. So that's why we have Dr. Carla here with us today, who's actually giving us some information on those. We're going to go to two areas before we head into a very sensitive one, dementia.
Sure.
And what really happens then. In the issue, what one, I'm not sure if you maybe studied that at some point in time. What goes to the mind of one who is on the verge of committing suicide?
Okay. So for people who are suicidal, it's very sad because their mind is pretty much shut down. They are hopeless. They do not see any hope whatsoever. They don't even want to seek help because they think, what's the point? So literally they've given up. And dealing with people who are suicidal is a bit of a challenge because generally if someone genuinely does not want to be helped, you can't help them. And that is the rule in mental health. You can only help someone who wants to be helped. Like I get calls all the time from concerned family members and friends, who say, I'm really worried about so-and-so because they're not behaving well. I know something's wrong. But I said, I can't do anything about it because I cannot contact that person and say, oh, your grandma rang me up today. I can't do that. It's ethically not possible. So it's very hard. I can probably only give family members tips on, what to do. And at the end of the day, it's up to that person. If they don't have the will to live and they don't want to live anymore, then unfortunately, there's not really much we can do. We can medicate them all we want, but what's the point? They don't want to be here. They'll find a way to commit suicide.
Well, what happens in the case of dementia?
Okay, so dementia is actually it's a mental illness. It's classified in what we call the DSM-5. So I don't know if you know the DSM-5. Okay, so the DSM-5 is actually kind of like the Bible for mental health. For mental health, yes. So all diseases and disorders are all classified in there. So dementia is actually part of a neuropsychological disorder. Okay, so there's different categories of dementia. And what dementia actually is, for people who don't know what dementia is, it's actually the degeneration of your brain and due to the death of brain cells. And that could be, most of the time it's due to old age. Okay, so as we get older, it's inevitable that we all, start to go downhill, as they say. But dementia has a lot of causes of it. So it can be natural causes, natural aging processes, or it could also be due to lifestyle changes, like bad diet, bad food consumption, things like that lead to other diseases, like, for example, diabetes, that can make dementia come a lot quicker. And
diabetes is linked to dementia.
Yes, because not directly linked, but diabetes can cause a lot of other problems, medical problems in your body. And what happens is these medical problems put a lot of stress on your brain and affects different hormones and things like that. So that can actually cause your brain cells to deteriorate and die. They call it atrophy, which is the death of your brain cells or cells. Dementia can also be caused by genetic conditions, like Alzheimer's. There's tests that can be done now. They don't do those tests in Dominica, but I think you can actually request for them to be done overseas. So there's different areas. There's congenital conditions that actually cause dementia as well. So, there's a lot of different causes of dementia.
Because it's very common, I find, in Dominica.
It is.
And the most difficult, or the main challenge is to get people to understand the disease or the mental disorder itself, and who have the skill set to be able to deal with people with such illness, because
To
sometimes
assess
in the
them.
first instance they just send them to a psychiatric unit, and this may not be the first step. It may have to be other steps.
Yes.
But I think one of our deficiencies, we don't have enough people that are trained enough to deal with this disorder,
yes.
and to still
Definitely.
see the humanity into the person and understand that the person is not well enough to command their brain.
Yes.
And it's a disorder. I think that's one of our deficiencies, and I really do hope that we can possibly sometime later on collaborate and do some workshops, train people to deal
Definitely.
with dementia, because part of what I
Definitely.
do, not only Creole Heartbeat, but as an ambassador, I really want to take this mental health issue as far as possible.
Yes.
And I really do hope
Very
that
important.
I really do hope that we can collaborate in that
Yes,
effort
yes,
to get
that would be
the
great.
educational aspect of it. You
For
know?
sure, for sure.
Because I know my dad. My dad suffers from dementia, and I know
Right, okay.
it's a very strange
And
disease.
it's sad and it's
And
stressful.
it is that strange when you know someone all of your life and see them slowly deteriorating.
Yes, it's heartbreaking.
And mentally, because the person used to be so mentally sound, and then you're seeing they are mentally,
Yes.
regressing. It can be a very difficult issue
It
to
is.
deal with. But one of the very most important things you mentioned a while ago, your food and nutrition
Yes.
can also affect you later on to get dementia. Just kind of elaborate on that for us a while.
Definitely. Well, as an example, just trying to think of some case studies that I have to give you examples. So, I've got a couple of elderly patients who suffer from type 2 diabetes, and they've got hypertension as well, which is high blood pressure. So, they've been on medication for a long time. Now, what's happened is their medication and their diet was not monitored. So a lot of people have this false perception that if I'm taking medication for my diabetes, I can eat as many sweets as I want. And I hear that all the time. People are, no, don't worry about it because I'm on medication. I'm like, no, you still have to look after yourself.
Manage your intake of sugar.
Exactly. Otherwise, the medication's just going to cancel itself out. So what's actually happened in a nutshell, this is simplifying things without using all the big medical words, which I don't personally like. So the diabetes actually led to kidney failure, right? Kidney failure. And then what happened is from the kidney failure, it led to a whole range of other issues which affected him. And it turns out that this particular patient also had an autoimmune disease, which he didn't know about, because obviously it's not something that we just test unless there's signs, and I think there was also a huge lack of education too and knowledge about diseases, So I sent him for a whole bunch of testing, and we found out that at the end of the day I traced it back to that.
Food and nutrition.
Food and nutrition. It all comes back to food and nutrition, because they say you are
And
what you
are
eat.
there foods that can sort of prevent you from getting dementia, that sort of thing?
It can't.
Food in certain with certain with certain
The whole
elements.
segment on food and nutrition.
Yeah, because it's important. Because based on our diet in Dominica, we have been seeing the rise of cancer. We have been seeing the rise of depression, of hypertension, and look, now it may be linked to dementia, which is also on the rise. So there's something that we are not mindful of.
Yes.
In our diet that is causing later on that we are so susceptible to those various diseases. So a whole lot of educating need to go on. That's why I'm asking if there are various food stuff that can lead to certain diseases. We know about the normal salt and sugar.
Yes.
But then in dementia, it may be a little more sensitive. Are there foods related directly to dementia?
Look, you can't really get rid of dementia as such, but you can slow down the process.
Okay.
Yeah, we can slow down the process, and the way you slow it down is eating healthy foods, like omega-3, for example. That's very good for brain health, things like that. So there are foods that you can take to slow it down. But coming back to dementia, you need to also find out the cause of it, because if the person has a genetic predisposition to dementia, meaning there's family members that have had dementia and it's part of their genes, then there's nothing really you can do about it because it's genetic. I mean, we can try our best to slow it down, which is what we do. But if it's genetic, then it's a little bit harder. Yeah, if it's a natural aging process, then maybe we could definitely slow it down. Yeah.
How do you diagnose stress?
Stress. Well, we diagnose stress, I guess, by looking at symptoms. And the most common symptom of stress is when people say they can't sleep at night, when they have insomnia. Yes. Insomnia. And that's very common. I would say it's the most common cause of stress that I see in my practice, because that's what makes people realize, oh, I'm stressed, because they're lying there at night and their brain is ticking. Their brain is ticking and they're thinking of all these things and they can't sleep. They can't shut down, basically. So that is the number one flag. If you can't sleep, generally, why can't you sleep? Yeah. And not just for one night. Yeah, we're not talking just one night. Yes.
Very consistently, you can't sleep.
Exactly.
Fatigue and those sort of things.
Fatigue, definitely. But fatigue could be due to a lot of issues too, could be. I mean, sleep is definitely a big factor, but diet is also another factor. Fatigue could also be lifestyle, maybe they had a big day yesterday, so they're absolutely exhausted, things like that. So we look at stress on a progressive scale. So if someone has been experiencing, say, a lack of sleep, fatigue, loss of appetite, things like that for maybe, let's say, 2 or 3 weeks, then that's a warning sign that, okay, let's start looking at this a little bit closer and see if it is stress or if it's a medical problem, things like that.
Let's look at the different stages of mental disorders. We know to reach, because one of the stigmas in Dominica is the medicating.
Yes.
Which actually slows down, I guess, especially patients who may be aggressive. Yeah. And you find that it slows down their responses. And I think that is one of the fears. Yes. Because most times in Dominica, you find people that possibly they are severe mental disorders, that they may be getting aggressive, they may be, doing things that they would normally do. Mm-hmm. But then there comes the medicating of the injection, which actually slows down the response. Give us an idea of the different stages before we reach to that, and we can possibly deal on that. Okay. Because I think one of the fears is the medicating. Mm-hmm. And a lot
of people are fearful of taking medication.
The medicating to slow down your response to everything. Give us the difference, the mental disorder stages to lead to severe.
Okay. So firstly, I just want to say, medication is there to prevent suffering, okay? But like everything else, people do abuse it as well. So I just want to say, I always say to people, my main treatment is to try and cure it without medication first, but sometimes in certain cases you need medication, and it's only on a short term. So I don't prescribe medication long term, okay? But coming back to your question about the stages, so we have different stages and severities of mental illnesses. So I guess we start off with the milder forms like, depression, okay? Generally people with depression, it's not likely that they're going to go around punching people up, Usually if they're depressed, they have anxiety as well. And they also have anger management issues. Okay, so it's a combination of everything. And to get to that final stage, basically, is a build-up of more and more and more of these, conditions that are worsening. And, the final stage is not just depression, anxiety, everything put together, but it could also be schizophrenia. And schizophrenia is, it's definitely a mental disorder, but that is also, it could be genetic too. And schizophrenia is separate on its own, because schizophrenic people don't necessarily, they can show symptoms of depression. But once we know they're schizophrenic, we don't normally say they're depressed, because schizophrenia overrides that. Schizophrenia is very serious. If you have schizophrenia, you need medication. If you don't...
What, define it for us, explain it for us.
Okay, so schizophrenia, to put it in simple Dominican terms, it's someone who is described as crazy. Okay, their behavior.
That's one of the severe stages.
Yes. So they have no they're very erratic in their behavior. Like 1 minute they could be so nice to you and be very normal, and the next minute they're jumping up and down with a knife trying to kill you, things like that. So it's very, very up and down. Okay, and schizophrenia is very severe. So most of the cases of schizophrenic people I know of, they are medicated, and they have to be, because if they don't, it's actually a danger to society. And they are a danger to themselves as well, but they are more of a danger to society.
So that's those who normally are at the unit where they could be managed at,
Yes.
possibly at the hospital.
Yes,
That
yes.
sort of thing, because of the severity of the disease.
Yes, but they can also, live in their own homes. And I know schizophrenic patients who live normal lives as long as they take their medication. As they take their medication, they can function like everyone else.
How
you know?
important is family support
Um,
in this scenario?
Well, I would say any form of support is very, very useful, definitely, and important. However, it's not in all cases that, people have that support. A lot of the time, it's quite sad, because I see a lot of patients that, especially when they get diagnosed with schizophrenia, they become alienated by their family, by their friends, because people say, oh, you're crazy, I don't want to be associated with you. And that's very sad, because that makes them worse. Now they're not just schizophrenic, but they're also lonely, they're isolated, they're abandoned, ignored. So any form of support is definitely very, very useful to them.
One of the areas which also concerns me is the increase. I'm not sure if you have noticed it driving around or commuting around. Is the increase of vagrants
Yes.
around town, and this may be due to several mental issues.
Yeah.
They eat from the rubbish bins.
Yes, I've seen
that
that.
sort of thing,
Yeah.
which is sad. They sleep on the road.
Mm-hmm.
What advice would you have for family members who may have, their families in that kind of condition? Because no one wants to be associated, which is a stigma itself. It's like most people do not want to be associated with people that are living on the road or a street
Yes.
life, and they themselves, they are on the road mainly because of whatever situation at home they could not deal with. So they try to escape. What advice would you have for situations like this?
For their family members?
Family
or-
members, yeah. Because family members that may have to accommodate them in some way to get them to bring them back.
Okay.
And have you spoken to any of those, or had the opportunity to speak to any of the vagrants and reach to them? Because I know it can be very difficult to get to them when they reach that stage.
Yes, yes. Okay, so to answer your question about the family members, okay, family members can definitely ring up. I think the best thing to do would be to get some education on what is mental illness, because for the vagrants to get to that stage, it didn't just happen overnight. They would have felt hopeless, worthless for years and years and years, and that led them to believe that, I'm just going to live on the street, right? So I think family members need to seek help. You need to seek help. Take them, if they want to, that is. Yeah, I mean, you can't force them. Take them to see a qualified professional, and someone who's compassionate and sympathetic about it. Someone who's not going to just brush them off and say, waste my time kind of thing. And I've heard stories about that before. So, I mean, that's basically all that they can do. I mean, at the end of the day, too, it's also up to the person, the vagrant, whether they want to be helped or not. Because we can only do so much. But like I said, if they don't want to help themselves.
Because by the time they reach on the street, it's like they're almost gone. And their lifestyle changes. They are
Yes.
dependent now on certain modes of survival.
Exactly.
And
Exactly.
So would you recommend, let's say, a home for them?
I think so, definitely. That was something I was actually discussing with a few colleagues about, is I think there should be like a shelter, for vagrants in Dominica. There should be a shelter, and they should have like, they provide food, lodging, and maybe even some psychological help, mental assistance, maybe help them get jobs, little jobs here and there, so they don't have to eat out of rubbish bins and things like that. Just start teaching them the basics, because that's what it is. We have to go back to the basics and start teaching them as if they were like a 15-year-old child. How do you earn an income? How do you go out and work? Things like that. But that's what society, I guess, should be doing to assist these people. But once again, we can't force them.
There are certain childhood traumas
Yes,
that, if not taken seriously or are resolved, can affect you later on in life.
definitely, definitely, yeah. Actually, a lot of traumas, generally a large percentage of it happened during childhood that has been unresolved. And I guess a very common one that I see is sexual abuse. Yeah, and that usually affects people because that is something a lot of people don't want to talk about. They keep silent about it, and so they just grow up with this horrible, horrible, ugly secret inside, and that affects their whole life. It affects their relationships with people, and things like that. So it's a very, very deep can of worms, to go into. But that's just one of the childhood traumas. Yeah.
How can people seeking assistance can reach you?
They can reach me on WhatsApp. So I'm available on WhatsApp. I am available online as well.
You're
I
free
do
to
have
give your
my
number if you want
website.
to. You
If
can.
I can remember my number.
Well, you could contact
During
me.
myself,
You could contact me, and I will.
265-7309.
No problem, but you could
Yes,
contact
I'll
me
try.
because we're going to form
Contact.
a coalition.
Yes, that's
We're going
right.
to form a force where we're
We're
going to
gonna
educate the
combat,
nation. Of course, and
mental
we're going to do
illness,
all the
yeah.
programs, all the projects where we can continue
Very
to educate
important.
the nation. So that's how they can. Where your facility is located?
So I'm mostly a mobile doctor.
Oh,
So I
mobile
do a
doctor.
lot of home visits because I do a lot of psychological assessments. But if people do want to come and see me, my office is in Checo, so just near Pioneer Prep School. So if you just message me on WhatsApp, I can give them directions.
I really want to thank you, Dr. Carla. We touched on so
it's a
many
pleasure.
things and how important one should assess themselves. You yourself, as a psychologist, assess yourself.
Yes,
And,
I have
actually
to.
give us-
Otherwise, I'll go crazy.
And it's so because we all go through different. I wanted to touch on one. You give me 2 more minutes to just last one. Gopwell. There's something they call Gopwell.
Gopwell.
Gopwell is sentimental
know a
disturbance. When but this one is a tough one.
Yeah.
And I mean, people do radical things to get
We
away.
could do a whole session on Gopwell.
Oh, you know about Gopwell?
I know what
Some
Gopwell
people come
is.
to you about that. Some
Yes.
people come to you with issues
lot
about,
of the-
about Gopwell.
No, a lot of my clients have told me that, if you see someone on the street and they're not right, this is what
A lot of
they
them
say
on the
is
street
Gopwell.
actually they were
I mean, I like
in some
Gopwell
rela-
music, so
no, not the music.
I
We're
know,
talking about
I
the emotion. If
Yes.
your boyfriend or wife or whatever,
yes, like
leave you,
breakups,
your
heartache,
breakup,
basically.
heartache.
Yes.
That is the real
Yes.
thing.
Hey, I do believe that there's a saying, you can die from a broken heart, and that's true.
But of course,
Yes,
of
because
course.
yeah, from a psychological perspective, what it is it's attachment issues, emotional attachment, because you fall in love with someone. That's a big attachment there, right? And some people, they have this dream, I'm going to marry this person and all this. You have this whole lifestyle plan, and then suddenly it doesn't work out. My gosh, it's horrible.
And then the
Everything
mere
gets
idea of
crushed.
possibly starting from scratch. You may have to share assets. That's the thing.
Yes, that's a nightmare. Yes, and then you think
lifetime
about
investment. Plus,
Yeah.
one of the biggest areas is if it's a woman and you see the woman all of a sudden getting nicer, looking prettier, looking more glamorous on the street, all of a sudden mentally,
that makes the Gopwell worse.
mentally, you can lose it.
Yes,
You can
yes.
actually, I mean, on
It's
the serious
true.
side,
It's true.
it
Yes.
is a mental disorder that people can, have to take care of and,
Yes.
and manage it.
Yes.
So, but I know Dominicans do very good in managing it. But I want to thank you,
Well-
Dr. Carla, for your final words before we leave.
No, I was just going to add something about the
Yeah, add it,
Gopwell,
add it,
because
yeah.
if say someone is married, right, and then if they're going to separate, there's all the legal processes and all, and that
Stress.
is stressful, man. I mean, apart from the heartache, you have to deal with legal stuff, money, financial. It's a nightmare,
I know.
and that is why everything compounds it. So it's not just the heartache; it's everything else
I
associated.
just want you to give
and
an
children
advice.
as well.
Yes,
if
give
they
an
have
advice to
children
the
involved.
nation about how to manage your mental health as we say bye-bye.
My most important advice is self-care. Yeah. Okay, always look after yourself and make sure you do something nice for yourself every day. Even if it's 10 minutes, Go for a walk. Do something that is you. Okay, not for anybody else but you. Even if it's like a cup of, kakao tea.
A cup of cocoa tea.
Kakao tea.
You love that.
I love kakao tea.
This was another Creole Heartbeat program. We're going to form a nice relationship with Dr. Carla. And our thrust to educate ourselves more and be more aware, be more sensitive to some of the mental issues that we are faced with in Dominica. It's something that we don't really openly talk about, because from the time someone says they have a mental issue, we think of the person crazy. And there are several stages, like the doctor told us, that one can reach. And if one assesses themselves very early, can avoid that line where you go to the next level of severity in terms of mental health. Dominica, I love you in bundles and I love you to pieces. We will see you next week on the Creole Heartbeat program. I'm Ambassador Prince Wadix. May God bless you and may God bless Dominica.
Yes, I. Sakai Malad. Prince Wadix. Prince Wadix. Prince Wadix. Prince Wadix.
Before God and all mankind, I pledge allegiance to the flag of the Commonwealth of Dominica and the sovereign republic for which it stands,